please rise as you're willing and able for our gathering song, Come, Come, Whoever You Are. And we are singing it a cappella, but our lead singers are right here in the front. So everyone, come, come, whoever you are, wonder, worshiper, lover of leaving. Ours is no caravan of despair. Come yet again, come again. Come, come, whoever you are, wonder, worshiper, lover of leaving. Ours is no caravan of despair. Come yet again, come. Look to this day, for it is life, the very life of life. In its brief course lie all the verities and realities of your existence, the bliss of growth, the glory of action, the splendor of beauty. For yesterday is but a dream, and tomorrow is only a vision. But today, well lived, makes every yesterday a dream of happiness, and every tomorrow a vision of hope. Look well, therefore, to this day. As Marshall comes up and lights our chalice, okay. We gather this hour as people of faith, with joys and sorrows, gifts, needs, fears. We light this beacon of hope, the sign of our quest for truth, meaning, compassion, and justice in celebration of the life we share together. So welcome, everyone, to the First Unitarian Church of Honolulu. My name is Catherine Graham. My pronouns are she, her, hers, and I am your worship leader this morning. We're so happy you have chosen to be with us on this Sunday morning. Whether you're a longtime member, friend, or a newcomer, no matter where you come from or who you love, you are welcome here. I am so excited to welcome my longtime friend, Jun Yang, to speak with us this morning. I've known Jun at least 15 years. Back in the day when he was a community organizer with Faith Action for Community Equity, thank you, I have it written here. And our church was very involved with Faith. We worked together on affordable housing issues. He then went on to work with the City and Council's Department of Housing and then Department of Transportation, and was their homeless liaison with them. And he's now the coordinator for the state of Hawaii on homelessness and housing solutions. And I love it when I can say, I knew him when. So welcome, Jun.
See if I can get this open. Good morning. My name is Jun Yang. I am the Governor's Coordinator on Homelessness, and I was appointed to the role at the end of February of this year. It's been the longest 5 months I've had in a long time. But what a blessing it has been to be asked to take on a role within this administration. First, I want to thank you for inviting me to be here with you this morning. I want to thank you for allowing me to speak up here. And I was asked to join you today by Catherine Graham, who I've known since I first moved to Nuuanu many years ago. And some may even remember me When I arrived here in 2008, when I was a community organizer for Faith Action for Community Equity from August 2008 till February of 2013. Some may remember, maybe not, but Drew Stolfi, Patrick Zucamura, Bob Nakata, Mike and Nancy Young. When I first got here, Nancy and Catherine were some of the first Unitarian members who worked with me on housing, immigration, and homeless issues across this island. So if I remember correctly, I think Zach, her son, and I went to Washington, D.C. back in 2010 or 11, and he was able to come with me to D.C. to see some direct actions when we were at the Capitol for People's Action Conference and Day of Action. It was fun to watch a young man see the influence of people power and how we can work together to raise up issues up to the decision makers. We were in the Capitol at the time just as the Consumer Finance Protection Bureau, or CFPB, was being created. And so we had pushed the administration to give the agency more teeth in the aftermath of the foreclosure crisis. I was flipping through some of your Sunday worships, and it was nice to see names I remembered. I remember Reverend Jennifer Kwong. I remember Catherine Nishida, Kyle Lovett, and I guess you had Neil Abercrombie come in and speak with you here before in the past too. These are names I remember while I'm working at FACE, or today I think it's called Faith Action, as a staff member. At FACE, and some may have been a part of this, but at FACE, the Gamaliel National Training that we held here in 2009, we had 150 leaders from across the nation. And we held the training here at the St. Augustine Retreat Center on the Poly. It was a week long, and my father was a part of that group, so it was really kind of interesting and fun for me, because I had a family member going through the same trainings that our local leaders were going through. And as a part of that training, we held our own direct action, delivering what we called an ethnic broom to the then-sitting Mayor Mufi Hanneman, demanding that he quit sweeping the community under the rug. And it was to create an office of housing where affordable housing and homeless issues would become and be a priority of the city administration. Now, why an ethnic broom? Because many of the city properties are in Chinatown. I bring this up to show how your church, working with Faith Action for Community Equity, Faith Action, helped to shape the local government here on housing, TOD, and homeless issues. It's a testament to the power of people working together on a cause. Now, Faith Action is really hard for me because I know it as FACE. So I'm going to call it FACE, and I hope you'll forgive me. It then created a city bill. And I'm just giving you a little history because it's really a part of a bit of the fabric of my own life and the work that I do today. The FACE created a city bill to put the question on the ballot to voters, all of us here, to create an office of housing and we worked with the 3 city council members at the time that were around working with us. And I remember at that time, City Council Member Charles Dejoux, he told us up front, I will allow 3 hearings for this bill, but on his 3rd hearing, I will kill it. That's what he told us. So we, knowing that this is the life of the bill, we said, okay, we will milk it for all that we can through this process for what it was worth. Media, council meetings full, packed with FACE leaders, meetings with every council member who would sit and listen to us. And funny how things happen. Since I am in a church, I think it's appropriate to say, I believe there was a moment, as some say, a God moment, because we could see the death of this bill in the next couple of weeks. But Charles Dejoux, I was about to say but Charles Dejoux was sent to Washington, D.C. as our U.S. congressional representative for 6 months. Just before the final hearing in the Legislative and Executive Matters Committee, which he chaired. The death of the bill was imminent. But something or someone intervened, and Councilmember Donovan De La Cruz sat down as a new chair of that committee. He read the bill and declared, I know this bill. I wrote it. And moved the bill forward to full council, their final review, hearing, and vote. It's interesting. The voters passed a charter amendment, and the interim mayor, oddly, Peter Caldwell, he was good on his word and created the office of the mayor, office in the mayor's office, staffing it with Keith Ishida, who was the first executive director for that office. They were focused on the city sale of the 12 affordable properties, which we called in the city the Happy Sale. I inherited that sale process, created the Housing First program, worked on ending veteran homelessness, and the basic foundations of Oahu and statewide best practice framework using data-driven decisions and process improvements while I worked under Mayor Kirk Caldwell in his first term. I was working at the Department of Transportation for the past 7.5 years, engaging with homeless individuals on state properties across the state in each of our counties. During that time, I supported the statewide Office on Homelessness and Housing Solutions. It's a mouthful. It's my office, my current office. And on some of the contracts and processes as they borrowed some of my time from Department of Transportation. Then on February 25th of this year, my daughter's 15th birthday, I was brought on to become the 6th governor's coordinator, exactly 12 years after I first entered public service. This was a direct result of the work that this church, First Unitarian Church of Honolulu, did as a part of the housing work group of Faith Action for Community Equity. We are all connected. This is very much true on the issue of homelessness. We are very much connected until we are not. When we become disconnected from things that help us thrive, we will fall into crisis and fall into places where people should not be. For this reason, our homeless crisis system was created to respond and accomplish a number of things. Reconnect us to our network where we can thrive again, help us rebuild connections, or recreate and rebuild connections to new networks where we can thrive once again. In a perfect system, this process would work flawlessly. That would be right? We would be able to identify when a person would be on the verge of breaking all of their connections in their network. The system would jump in and help mend those connections before network failure. Or the system would immediately jump in and help mend those connections, jump in high gear once a person fell into homelessness. But sadly, this is not the case for Hawaii or for the rest of the nation. I know that you are all very well aware of this. I have an image that came to mind a couple of years before COVID, as I was trying to figure out why we are in the situation that we are in, and in many ways still are dealing with. I realized that our system was built upon former systems, which may have worked in some ways and didn't in many other ways. I have an image from Mary Shelley's The Monster in her book, Frankenstein. The monster is thought to be created from human parts and animal remains. I imagined our homeless response system in much the same way. Interestingly, the system works, not perfectly, and in no way is it beautiful. Many parts are from previous federal, state, local, philanthropic funding or ideas or initiatives. But because these are not completely whole, they do fail. In the places where they fail, gaps in the system, people fall and they fall into homelessness. This image has been with me for a better part of a decade. I had asked one of my high school kids at church, who was an artist, if she would be interested in creating a political cartoon to publish in the paper. She was too busy with college applications and finals to jump on it, but she said that it was probably a fun project to do. If any of you are artistic and are interested, please feel free. We can work on this together. Of course, this is not a perfect analogy. It only highlights the brokenness of the system. And I do not want to forget that the monster lived in her story. In much the same way our homeless crisis response system functions, not a well-oiled engine or machine, but it works to get people into shelter, into housing, reconnected with family and friends, back to work and into health. Now, Governor Josh Green is a medical doctor. He worked in the emergency rooms and will continue to go out into the streets to help individuals on the street with wound care and connection to medical services. He still goes out from time to time and will put on his scrubs, and he does this when no one is looking because he is connected to the issues. Because of my work at the Department of Transportation, I witnessed some of the hardest things I will ever see. As a youth and a younger person, I went on mission trips to places where there was no real infrastructure. I was shocked to see places in our community that looked like those third world locations. I had witnessed and worked in those areas, and it was difficult to see remnants of those ideas here. In the shadows of comfort and wealth, we have people living in shanties that remind of places you read about in the news and in magazine. We have people living in situations where there is no running water or access to hygiene. Rats, roaches, centipedes, scorpions, they live with them. No one in our wealthy nation should be living this way. I'm grateful grateful to have worked with leaders who have strong visions. Governor Green's vision is to bring health to parts of our community where they have little access to it. So in this administration, it has a big vision where housing is healthcare. I follow the work of Scott Morishige, who worked with me, or I got to say, I worked with him for 6 years while he was the governor's homeless coordinator under David Ige. I learned a lot from him. I worked with him while I was at FACE, again while I was at the city, and worked very closely during the last administration. Then James Kushiba became the governor's coordinator when Governor Green brought him on into the administration. James helped to create a framework for Governor Green's Kauhale initiative. Kauhale, as most of you know, is a native Hawaiian term that we understand as community or village. We are building Kauhale across the state to address unsheltered homelessness. At that time, then Senator Green built the very first Kauhale in the area called Barbers Point. It's called Kamaoku, which is operated by U.S. vets on state land. 37 tiny housing units were built with a community of builders and philanthropic donations. This administration's first Kauhale, this one, was a proof of concept pilot on the Department of Health's parking lot across from Queens Hospital. It was built on 2023. You probably saw it while driving on Punch Bowl, wondering what is that thing on the right side? Yeah. 13 medical respite bed units to address the need of our healthcare partners where individuals who are homeless when they enter the hospital would have a place to recover and reconnect. The nearly one-year pilot served the community as a recovery respite program and as a place for individuals to access mental health and homeless services and bathroom and shower facilities. Today, we have built 23 Kauhale across the state and created over 900 beds. The goal is to serve half of those experiencing unsheltered homelessness. And we are almost there. Why this goal? We need to kickstart our system to be able to respond faster and better. Based on the 2023 point-in-time count, our goal is to create 1,400 beds with programs in each county. What is really exciting for my office, the statewide Office on Homelessness and Housing Solutions, we'll call it SOHHS, it was created by legislation in 2022. We've never really had a budget to work with. And in fiscal year 2023 and 24, the legislature provided over $60 million to build and fund operations, which created the opportunity to build Kauhale programs where we partner with nonprofit and counties. For example, City and County of Honolulu, Kauai, Maui, Hawaii, Mental Health Kokua, US Vets, IHS, Project Vision, HHRC, or H3RC, Catholic Charities, Hope Services, Salvation Army, Homemade Hawaii, YWCA here and on Kauai, and many others. This year, the legislature, in their wisdom, I say it, in their wisdom, passed our Kauhale funding bill. The governor signed it into law, and it's called Act 309, where in this biennium, we were given $88.2 million to continue funding our programs that we have established already and build another 5 to 10 projects in each of our counties. These projects will help us get to that goal of 1,400 beds. What I see in the framework that James Kashiba provided and from where I am building upon his foundation is a foundation where community and the idea of being a good neighbor will help build up healthier places for individuals to change the trajectory of their lives. The idea for me is if you come into our kauhale, it'll forever change where you're going. Healing in all important aspects of the individual's lives: mental health, addiction, social and family networks, job, employment, training. And so I want you to imagine the feeling of closing the door and having a safe place to rest your head. Many of our unsheltered do not have that. The dignity of a clean shower and clean clothes, simple things that we take for granted. We have created, with the cooperation and partnership of the City and County of Honolulu, the Behavioral Health Crisis Center in Iwalei, the BHCC. I have a lot of acronyms for you today. This was created in the last couple of years as a way to redirect emergency room visits and admissions for individuals that were transported due to MH1 or assisted community treatment orders. These are individuals who are in crisis, who are on the streets, where their mental health has led them to being transported by law enforcement or emergency personnel. Many of our hospitals, including Queens and Straub emergency rooms, have limited capacity. They're not well equipped to addressing the follow-up services that are needed for people when they are discharged. That is why we see so many people laying on the sidewalks along Punch Bowl just outside of the hospital and in Thomas Square. They are still in their medical gowns with their belongings strewn on the lawns or the sidewalks. The BHCC and places like the A'ala Medical Respite were created through state DOH funding and kauhale funding to serve these individuals, to stabilize them, address medical and behavioral health needs, and they are well suited to connect individuals at discharge to more appropriate next step services, where they are now able to access shelter and housing support. We look to our Medicare expansion project, where housing support funding is included in MedQuest programs. It is, as they say, a game changer for us as we're thinking about it. And so I'm working closely with MedQuest Division at the Department of Human Services to better serve the people that need it where they need it. And it's an exciting time. It's an exciting time for me because we have a governor, a leader who understands the nuances of the system, what it really looks like on the streets and on the ground on this very difficult issue. Lastly, we have a very special person in the governor's staff, senior staff. His name is Dr. Champion. What a name. He is a champion on mental health and justice diversion. He's teaching me quite a bit. I was able to join him in Miami-Dade. It was not a junket. I went there to learn on what they are doing in their community, to have improved outcomes for individuals who would normally have been incarcerated, and in incarceration where their mental health would have deteriorated. But instead, being brought into a place where they can work within the court system and have direct access to mental health and homeless resources. We are creating this program here with the courts here in Hawaii and have a location and are looking to build out the facilities to serve in the best possible way. The goal, as you can hear, is to never discharge an individual from homelessness into homelessness. The position that I am in really has one job. If you go back to the statutes of what the homeless coordinator is supposed to do, it is to chair the Hawaii Interagency Council on Homelessness, and we call that the HIC, another acronym, HICH. But my role gives me the opportunity to build innovative projects and programs to fill the gaps within our system. I hope that as I work for the state and the governor, that I will be able to help our response system to work more effectively, knowing that every interaction is a human interaction. My staff, I have made this a point, are all required to know what the situation looks like on the ground. And my newest hire, he's just completed 3 weeks. He will be going out with outreach to serve the unsheltered, shadowing our outreach partners so that he knows better how to respond to community concerns as they come into our office. I'm going to take a pause here, and I was asked on what is the state of our homeless situation. Now, our point in time count gives us some numbers, and they're only good as the volunteers and the information that are given. And so every year, as a part of our HUD funding, of federal funding, volunteers and staff go out into the communities across the state, and they go out to visibly check who's out there and visibly count how many individuals are out there on any given night. So we say about January 22nd of every year, they go out with all the service providers across the state. And it tells us we have about 4,000 to 5,000 individuals at any given time. This is a hard number to really understand because it's just a snapshot. It takes a picture at one time. People fall in, people are brought into shelter, people are brought into housing, and some individuals resolve homelessness on their own. Some, with the help of congregations or communities that they're a part of, are able to find support and move on from unsheltered homelessness into housing. But as the numbers always fluctuate, it's really hard to get a real gauge on what the situation is on the ground. That is why we're using just the unsheltered number from 2023 to give us an idea of how we can build, what to build right now. That's why we're saying 1,400 units of beds, shelter space, kauhale units, so that we can kickstart the system and rejigger the engine that we have to better approach the needs that are in the community. Now, there are many competing interests on every level. I told you, federal, state, local, philanthropic. I've been a part of it in every way. And in these different places, you have different leaders and you have different ideas that want to push a certain way. Many times they're pushing in different directions. We're hoping that from the governor's position, that he is able to help align all of us together in one direction so that at least we can go one way. We all talk about being in the canoe or in the boat together and row in one direction. That's what we're trying to do in this administration. And because the governor has a better understanding of what the healthcare needs are, and he knows by serving the individuals on the street, by saying, you know, it's not just an idea or a concept, but this is what I see and this is what I feel, this is what I touch. He's able to help direct funding in creative new ways, such as the Kauhale initiative, and say, can we build faster? And so we're using different tools that we have in the state to help ourselves, to help the counties, to help the private sector as well, build more and address the needs that we have on the streets. So, what can we do as a community? There are many things that you do already. Come and visit the Kauhale. It'll be open to you, of course. It is a community resource for our community, and so we'll never close the door to you to come and visit and to find out ways that you can help engage our individuals that are there. It could be through support in social ways. It could be in whatever initiative that this congregation wants to do, in job employment, training, in therapy, in many different ways, spiritual support. These are things that this congregation, I can imagine, can do. I know of many congregations across the state, Christian, Jewish, Buddhist, Unitarian, that have been a part of the crisis response in Miami, in Maui, the fire response. These are things that we see as a disaster response. Our disaster on the streets in unsheltered homelessness has been going on for so long that people forget. It is a real disaster, a real crisis that our communities can address in many different ways. And so your talents, we're asking you to bring them in. It'd be wonderful to be able to find ways to partner together with congregations like yourselves. So we have one in Windward, the Ko'olau Kauhale, that was built on a DOT maintenance yard. We pulled out a portion of that yard, about 30,000 square feet, and built that space in amazingly 6 weeks. So fast that the community was shocked that it came up so fast. They said, "What is this? Can you tell us what you're doing?" And I think that at the time, the governor's office and the people that were in my office before me were not ready to talk to the community fast enough to the speed of building, which nobody expected government could ever do. I laugh because it's true, it's slow. But we were able to build 34 beds, tiny units in that space, and it's healing and supporting these individuals who've been unsheltered, who are dealing with addiction, who are dealing with many different issues. And we want to bring healing into that part of the community. And the amazing part of it is this. Windward Side has always said, we want to see you do this for our community. and we built that one up first. It came out first. And so the other part of it is that we promised that those individuals that we're serving are going to be from the Windward community, that we're not transporting people from other places, other islands, other states to fill the gaps or fill the beds there, that these are Windward community members that are being served. We have one that we just opened up earlier this year, the Alana Olapono, which is in Ivole. IHS is a service provider there. We have 45 tiny units there. You'll be pretty amazed when you come in to see Ivole is a chaotic space, but it's right next to the senior residences that the state helped fund and put up. Right next door to 888 Ivole. And in that space, we've already housed nearly 20 people, permanently housed from that site. 45 people have come in, 20 people already within the few months that they've been operating have gone on to permanent supportive housing. That is a testament to when a system works well. And you can also come and visit our project over in Middle Street. This is the one that is run by H3RC, a great organization, a low-barrier community that works on building up the community infrastructure of individuals, building up their networks, building a community together so that they can help build a future, the trajectory that they want to go into. It's pretty amazing what they've done. And on their own, they said that employment is going to be a part of how they bring healing to their community, to their people. They want to be able to help bring people to jobs that pay well so they can end homelessness forever. Now, coming to the end of my talk, I pray for a day when our community members will be healthy, safe, and resilient. When I read the obituary of Terrell Kimball from Portland, Maine, she is the mother of a dear friend and fellow community organizer who passed away. David Kimball, who was a mentor to me. He shared that she personified the Unitarian dictum that says, service is our prayer. It's something I didn't know until I read that obituary. I believe that our role in our community is to be of service in many ways. I appreciate my connection with your community. I am moved by your service and how you've been a part of my history and the change in our island and our state. I believe that communities like yours are the resilience that builds a stronger island where no one will be suffering on our streets, and our streams and our beaches. We are all connected. Please continue to support organizations like IHS and the Food Bank and Helping Hands. If you're still working with organizations like Faith Action, please share how their work created some of the change in our system, and continue to pray with me. I thank you for the opportunity to speak with you today.
Thank you, Jun. I just want to say, because I think maybe some of you don't know, that one of the things that we are doing currently is housing a homeless family through Family Promise. And so we do have a family upstairs. It's Caesar with his 5 children, and they are victims of the Maui fire. And so you might see the kids running around, they're wonderful children, and it's wonderful that we have that space upstairs that we can offer to that program. So if you will join me now, stand as you are willing and able to sing our song, When I Needed a Neighbor, and we have accompanists even. And I'm gonna, we'll put the words up and we'll sing the first verse through first, and I'll kind of teach it for those of you who don't know it. Okay, Deborah. When I needed a neighbor, were you there? Were you there? When I needed a neighbor, were you there? And the creed and the color and the name don't matter, were you there? Okay, so you guys, you got it? All right. Okay, let's go. When I needed a neighbor, were you there? Were you there? When I needed a neighbor, were you there? And the creed and the color and the name don't matter, were you there? I was hungry, I was thirsty, were you there? Were you there? I was hungry, I was thirsty, were you there? And the creed and the color and the name don't matter, were you there? When I needed a shelter, were you there? Were you there? When I needed a shelter, were you there? And the creed and the color and the name don't matter, were you there? Wherever you travel, I'll be there, I'll be there. Wherever you travel, I'll be there. And the creed and the color and the name don't matter, were you there? Thank you, Deborah. Thank you, everyone. I also want to see if there's anyone who would like to accept Jun's invitation to visit the Kauhales. Come and see me. We can get a group together and coordinate with him and go see what this is all about and how we can help from there. So our time together is finished, but our work is not done. May our spirits be renewed and our resolve strengthened as we meet the challenge of the week to come. The chalice is extinguished until we ignite it again with the spark of our community. Oh, my goodness. You know, I always forget something. Okay, so we have an order of service, and then we have my script, and they don't match at all, but just fine. I've got those. Okay, so it would be good to have an offering. And we have our rentals upstairs, and we have our pledges, and we have the rentals of Sophomoroff, which is a Jewish community who meets here on Saturday mornings, and we have a Chukis community who meets here on Sunday afternoons. So when we do our Sunday morning collection, we share the plate with a needy organization. And this month, our needy organization is us. It's our emergency fund. We have an emergency fund for members and friends who are in dire need of finances. And I learned that our emergency fund is in the hole by $2,000 because we had lots and lots of emergencies in this last year. So as we pass the collection bowl, please be generous. And we have lots of ways to share. And there we go. You can text that number, and it will take you to a secure site where you can put in money, or you can go to our website, or you can scan that QR code. So, and I don't understand any of those things, so, but some of you do, and that's the good news. So please be generous. Thank you. Your generosity is wonderful. Thank you, and I'm glad it's better than my being able to lead this service. Thank you. Thank you very much. Now we can extinguish the chalice, which we've done. And my words of benediction are from Rabbi Hillel. If I am not for myself, who will be for me? If I am only for myself, what am I? If not now, when? And last time I looked, there was nothing in the Book of Life for this week. So I just want to reiterate that this yesterday was Sue Yamani's birthday, Sue Yamani Carpenter's birthday. She was 75. It was her 3/4 of a century. She celebrated in Idaho, and we wish her a very happy birthday, even though she didn't get to travel around the world like they did for Dan's 75th birthday. So I do have some announcements this morning. The ministerial search team has published the results of the congregational survey. It's in the Wednesday newsletter online, and you can find it there. And it's in 2 sections. Part 1 is the summary of the report, and Part 2 lists the additional comments that people had. So please check it out. And if you don't receive that newsletter, talk to the welcome table back there and sign up, because we would want everybody to be able to get that newsletter. Second announcement, when you go in to the gallery for refreshments, notice the new artwork that's up there. All the artwork that's up there is by our own Marshall Heaney. And the gallery looks great. The gallery on the Poly is one of the oldest art galleries in the city and county of Honolulu. And since COVID, it's been a little troubled. But today it looks terrific. So thank you, Marshall. It looks great. Okay, and we have 2 committees that are requesting interested folks to join them. The first one is our Aesthetics Committee. This group identifies interior and exterior areas of our church that need beautifying and work, and to create a more aesthetically pleasing, serene, safe, and clean physical and visual environment in which to welcome guests and for us to enjoy also. So they meet monthly, to walk through and walk around and say, oh my God, we really need to straighten out those name tags back there, or whatever, And so if making things aesthetically pleasing, or if there's something that really bugs you around here, talk to Marie. And she's the one who's in charge of this and can give you more information. Maria also chairs Hospitality, which is the group that brings out yummies after the service for all of us. And they would like to have some help also. And Marie buys and supplies all the the important things, but we need people to help set up and clean up afterwards. And it's a fun way. I call it kind of the entry drug to the Unitarian Church, because it's an easy thing to do and it gets you more involved with people and everything. So if you'd like to help with that, please see Marie too, and you can find her. So thank you very much. So if you will stand now, and if you're willing, join hands. And those of you in the back, if you would be willing to come forward for our closing hymn of Hawaii Aloha. And if you're willing to join hands, that would be great.